What is IBS? So IBS is, like I said, is based on a combination of symptoms. It's more common in women, it's more common in younger women. It is either constipation or diarrhea or a combination of both. Requires pain that is resolved with a bowel movement. Incomplete evacuation, gas and bloating are all highlights of this syndrome, and there's really no great diagnostic test. Hello, everybody, and welcome back to the Good Gut Feeling podcast, where we digest modern medicine with old world wisdom. Before we jump right into today's topic, quick order of business. This episode, all future episodes, all prior episodes are for educational purposes only and do not take the place of your doctor's advice. Today, we're going to talk about a very, very common condition that is seen in the gastroenterologist more often than any other condition. It's also, unfortunately, has become the most frustrating condition to treat in a standard gastroenterologist office because there is no real pharmaceutical treatment that is effective and consistent. So what is it? We're going to be talking about IBS, Irritable Bowel Syndrome. It is considered one of the functional disorders. Functional really means that in the conventional model, there is no good diagnostic test. It is simply based on a combination of symptoms and therefore called a syndrome rather than a disease. And there's really no great treatment. And even though it's the most common condition seen in a GI's office, it is the most frustrating condition to treat for a standard practice. I will tell you, before I changed the way I practice, I had personally been doing thousands of colonoscopies and endoscopies and prescribing acid blockers just the same way that I was trained. And I would see patients with irritable bowel syndrome in the clinic, in the office, and I would feel very frustrated because they didn't get better. They were upset. I really had nothing else to provide for them. And it became a very unsatisfying experience for both. Now, a totally different process. What is IBS? So IBS is, like I said, is based on a combination of symptoms. It's more common in women. It's more common in younger women. It is either constipation or diarrhea or a combination of both, and has to do also requires pain that is resolved with a bowel movement. Incomplete evacuation, gas and bloating are all highlights of this syndrome. And there's really no great diagnostic test. In fact, invasive diagnostic tests are typically not even indicated. So basically, if a 30-year-old woman comes in and says, I have gas, bloating, et cetera, I have a, alternating diarrhea, constipation, when I go to the bathroom, I feel better, that is usually enough to diagnose IBS. However, it's not really a diagnosis. It's just a combination of symptoms that have different root causes depending on the person. However, it gives us a very good idea of how emotions affect our gut, because the highlight of this syndrome is that it is very frequently associated with depression, anxiety, prior history of sexual abuse, and especially in women. So how do those things go together? How do we put it together? And how can we explain what is the root cause of IBS? And how can we help a person? How can you help yourself if you have these symptoms? So number one, we talked about that it's very much associated with a mind-body connection. Number two, it's associated with food sensitivities. Well, we already talked about this many, many times over and over. What are the root causes? The root cause is not deficiency of a medication. The root cause is not even usually genetics, because we know genetics create a predisposition. The root causes usually fall into several categories, one of which is the mind-body connection. Another one is food. Another one is toxins. And really, can they really explain all three? So emotions. Well, we have an experience. We have a negative experience. We have a challenging experience. We have a life experience. And what happens after that? If this experience was something difficult, something that we were not able to resolve completely, get over completely, well, we have a stress response. We have a stress response. So now I have some kind of challenge in my life. That challenge creates a thought process that is perceived as negative. And that negative process that is in my thoughts creates a stress situation in my body through different neurotransmitters, most commonly cortisol. So what happens in the body? Well, according to many traditional systems, we store emotions in our organs. And even which emotions we store in our organs are consistent, whether you look at traditional Chinese medicine, whether you look at Ayurveda, whether you look at Jewish mysticism, you can see consistency. We store fear in our kidneys. We store anger in our liver, etc., etc., and etc., and it's across the board. And I see this very clearly with my patients, that these emotions that are stored in the body are coming from a negative experience. Now, there's negative experience, creates a stress response in the body, the organs store the emotions, and then the downstream effect happens, whether it's constipation or diarrhea or pain, etc., etc., etc. Number 2, association in irritable bowel is food intolerances. But are there really intolerances? Could be that they are, or it could be that it's just the quality of the food, or it could be that it's the actual food. Most commonly, gluten, the way that exists in the commercially produced products in the United States, is very triggering for many people. And even people who don't feel initially bad after eating it, it's not something that's really recommended for their health because of the genetics of the yeast, because of the genetics of the wheat. The wheat is grown with the pesticides such as glyphosate, the way that the bread is made, for example, with instant yeast. There's many factors why breads today, wheat products today, from commercially sourced companies in the United States are a toxic product. Dairy is a very common issue for many people. Dairies also become a toxic product because of the poor health of the animals, because of how the milk is processed with homogenation and pasteurization. But some of it is just quality of foods. Someone eating a lot of ultra-processed foods. Are there a ton of chemicals in the ingredients? Can you pronounce them? If you can't pronounce them, don't eat them. Seed oils. So foods can trigger this. Another common question that I get, well, how do I figure it out? How do I test which foods? And I know there are a lot of tests out there. Some of the tests are true allergy tests. Some of those tests are food sensitivity tests. The food sensitivity tests have not been standardized to really be a test that we can hang our hat on for a diagnosis. I have seen them sometimes correlate and many times not correlate. And I don't believe that they are helpful in figuring out the process. We can figure out the process using logic, using intuition, using experience, narrowing it down, knowing what foods are generally good. And that is a much more effective process than doing the IgG, for example, food sensitivity test. Food allergy tests are something different. They're done in different ways. They typically require response, meaning someone has a response, wheezing, their throat is closing, they have itchy skin, etc. after eating a nut, for example, and then they have a test. That test shows, let's say the IgE blood test, that test shows that there is a response. In addition, which makes it more specific with the allergic response and the positive test together can really make, we can hang our hat and say this person's allergic to this. But even doing just plain old allergy tests without really knowing what we're looking for and having some low level of elevations can be very nonspecific. So the best way, unless we have a true allergy, unless we have a response, unless we have a very high test on our allergy panel, for example, the skin test or blood tests that are very high, it's really, and in addition have a response, these tests are generally not helpful. Another very common trigger for many people is antibiotics. And antibiotics really affect the microbiome. They really affect the microbiome in a negative way. They kill the good bugs, they kill the bad bugs, but the good bugs actually help our immune system. They help balance our body. They help with inflammation. So something that we really need. So if we take antibiotics, it can help us feel better in the short term. But taking a lot of antibiotics can predispose us to many things. And many people with irritable bowel get triggered by antibiotics. So at the end of the day, we still come back to the same thing. The root cause is always in one of these three categories: the mind-body connection. What goes into it: sleep and exercise and stress and past experience and relationships. 2 is food. Are we eating high quality foods? Are we eating the foods that are right for us? Are we doing our research to make sure that the foods we're eating are non-toxic, have been grown well? And it does require work because unfortunately, the baseline in the United States is a low level of quality of food that we need to be vigilant and look into labels. We can't rely on someone saying, oh, this is good and this is bad, or this is healthy and this is not healthy, because that is a very vague description. There's plenty of things in the health food store that's not healthy. So we are responsible. We need to look in. We need to be vigilant. It gets easier. You get used to it. The beginning, it's hard. Oh my God, to read labels every time. I already don't have time because of X, Y, and Z. It gets easier. 3 is toxins. One of the most powerful pharmaceuticals that is really disruptive to our microbiome is antibiotics. And as we spoke about before, antibiotics can be life-saving, but they're way overprescribed. And sometimes doctors even prescribe them because they feel the patient wants it. They feel someone wants the antibiotics. So if someone comes into the doctor's office and says, hey, I have a fever, a sore throat, a cough, etc., etc., etc. The doctor sometimes may feel, okay, it's not really needed, but they feel they have to do something. They feel they have to give something, or else, like, what's the point of you coming in to see them? They feel like they owe you a treatment, when sometimes the best treatment is empower your immune system, drink your fluids, get some rest, get some sun, increase your vitamin D. But that is sometimes not what the person's looking for, and doctors feel they have to give the patient something. And we are seeing so many issues with antibiotics, not to mention personal issues with the individual patient, but we're seeing resistant bacteria. We're seeing liver problems. The many overuses causing problems. So remember, many of you watching this may have symptoms of irritable bowel. Many of you out there may went to your doctor and said, okay, you have irritable bowel, like do X, Y, and Z. That's not helpful. But remember, take it back to the roots. Take it back to the source. Deal with your stress, meditate, exercise. Pick the right foods for you. Sometimes it requires trial and error. Try to avoid excessive antibiotics, excessive pharmaceuticals. Minimize that. You will need less if you are optimizing your emotional health, your schedule, you're prioritizing your healthy diet, your intermittent fasting. There's so much you can do to optimize your health. And then see, maybe I won't even need X, Y, and Z because I've done all this amazing stuff to build my health. Stay healthy, stay gutsy. I look forward to seeing you all next week. If you like what you're hearing, there's so much more content on wholegut.com. Our contact info is on there. Have a great week.